Alzheimer's disease is a common form of dementia. Dementia is the progressive loss of brain function. There are many causes and types of dementia, and Alzheimer's disease is one that can be helped initially with drug therapy. In Alzheimer's disease, there is a familial tendency or genetic predisposition to develop problems in and around brain neurons that affect their function. The protein beta amyloid builds up and forms deposits in the brain. The microtubules in the neurons also become tangled and form non-functional meshes in the brain. Levels of the excitatory neurotransmitters ACH are decreased in the brain, which results in more difficulty with the memory and the learning. Blood flow throughout the brain decreases, and over time, these changes reduce the size of the brain and all aspects of brain function. The cross-sections of a normal brain and brain affected by Alzheimer's disease, the neurons die in the area of the brain that are important for memory and language. The symptoms of early Alzheimer's disease involve memory issues and can be mistaken for normal aging. The disease is progressive, and memory problems become increasingly more challenging, such as getting confused regarding times and places or forgetting how to get home. Changes in mood, judgment, and personality eventually occur. There are potentially 10 warning signs of Alzheimer's disease. Memory loss that disrupts daily life, challenges in planning or solving problems, difficulty completing familiar tasks at home, at work, or at leisure, confusion about time or place, trouble understanding visual images and spatial relationships, new problems with words in speaking or writing, misplacing things and losing the ability to retrace steps, decreased or poor judgment, withdrawal from work or social activities, and changes in mood and personality. More than 5 million persons suffer from Alzheimer's disease. The risk factors include older age, greater than 65 years of age, a family history of Alzheimer's disease, and having a APOE4 gene. Unfortunately, no single test can be used to diagnose Alzheimer's disease. Instead, the diagnosis is made based on symptoms, family interviews, physical examination, and neurologic and cognitive examinations. Drug therapy does not cure Alzheimer's disease. Drugs used for Alzheimer's disease, which provides only temporary improvement in symptoms, include cholinesterase inhibitors and N-methyl-D-aspartate, also known as NMDA blockers. The effectiveness of these drugs varies from person to person. The length of time for which a drug is therapeutic is limited. There are a list of these drug names, adult dosages, and nursing implications. The research in the area of Alzheimer's disease is ongoing, and help for family and professional caregivers is ongoing and available. Cholinesterase inhibitors is a classification. The action is delayed memory loss in Alzheimer's disease by binding to the enzyme acetylcholinesterase and slowing its action. which allows any acetylcholine produced to remain functional for a longer period. Example drugs are donepezil, known as Aricept, and rivastigmine, known as Exelon. The drug therapy attempts to increase acetylcholine levels because this excitatory neurotransmitter is reduced in the brains of patients with Alzheimer's disease. Acetylcholinesterase is an enzyme that specifically breaks down acetylcholine. A cholinesterase inhibitor is a drug that binds to acetylcholinesterase and slows its action, which allows any acetylcholine produced to remain functional longer. This action appears to delay memory loss and improve the patient's ability to perform his or her activities of daily living. Unfortunately, the drug is useful only temporarily. As the disease progresses, fewer intact neurons are available to make acetylcholine. When this occurs, the drug is no longer effective. 3 cholinesterase inhibitors are used in the treatment of Alzheimer's disease. Donepezil, known as Aricept, rivastigmine, known as Exelon, and galantamine, known as Razagdine. The nursing implications: give donepezil once a day in the evening. If using the disintegrating tablet, place the tablet on the tongue before swallowing. Teach patients and families to measure and give the oral solution with a syringe. Rivastigmine must be given with food. If using the transdermal rivastigmine patch, apply once daily to clean, dry, hairless, intact, healthy skin on the upper or lower back to prevent removal by the patient. Do not use on areas with recent application of lotions, creams, or powders. Rotate application sites daily. Do not apply to the same site more than once every 14 days. May be used while bathing or showering. Apply patch at about the same time every day. Always remove the old patch before applying a new patch. Give galantamine twice a day, oral dosage with food, or give the once a day oral dosage in the morning with food. If using the liquid oral form of galantamine, measure the ordered dose with the enclosed pipette into 3 to 4 ounces of non-alcoholic drink. Monitor weekly weights because these drugs may cause weight loss, and monitor laboratory work as ordered to ensure safety from adverse effects. It may take several weeks for the drugs to have a therapeutic effect, and these drugs do not cure Alzheimer's disease. If difficulty breathing, fainting, or GI bleeding occurs, notify the healthcare provider immediately. Notify the healthcare provider if expected side effects are causing increased discomfort or new symptoms develop. Use the bathroom every 2 hours to avoid urinary incontinence because these drugs increase urination. Have the patient take galantamine or rivastigmine the same time every day, twice daily, with food to help avoid GI upset. The patient may have an increased risk of falls because these drugs can cause dizziness and weakness. Make sure the patient and the family knows to keep the follow-up appointments. These drugs are important to have the patient re-evaluated to understand what the therapeutic effects are or the adverse effects are on the patient. It is important to understand if a baseline weight is on the patient before starting these medications and that a weight is being assessed weekly at intervals. These drugs can suppress the appetite and contribute to further weight loss. Observe for signs and symptoms that may indicate a GI bleed, such as dark tarry stools and decreasing hemoglobin and hematocrit levels. Monitor blood tests and levels and report abnormal baseline liver function studies, including a BUN and creatinine levels, to the healthcare provider. Because abnormalities can affect the metabolism of these drugs, assess the urinary patterns and reassess for changes that may indicate side effects of the drugs. Before a patient starts a cholinesterase inhibitor, assess the patient using an Alzheimer's disease assessment scale so that an objective evaluation can be made when evaluating for symptoms of improvement. The assessment tools that evaluate cognition, function, capacity, behavior, and general health and the quality of life. By using these tools, you can better gauge how and whether the drug is helping the patient. Assess for swallowing difficulties so that the proper drug formulation can be given in liquid, sublingual tablets. Monitor patients who have asthma carefully for worsening signs and symptoms of asthma. Check the vital signs, especially heart rate, and look for adverse signs and symptoms indicating parasympathetic stimulation. Some expected side effects and adverse reactions of cholinesterase inhibitors include mild diarrhea, especially when starting treatment, drowsiness, headache, loss of appetite, GI discomfort, joint pain, and muscle cramping can occur. Adverse effects include hallucinations, dysrhythmia, GI bleeding, infection, and difficulty urinating or incontinence. These drugs increase acetylcholine concentration. They are considered to be cholinergic agonists and can have adverse effects on other body systems, causing symptoms of overstimulation of the parasympathetic nervous system, the rest and digest nervous system. Which would result in slow heart rate, low blood pressure, heart blocks, fainting, convulsions, headache, seizures, sweating, increased secretions from the GI tract, increased salivation, abdominal cramping, vomiting, diarrhea. In the respiratory tract, increased secretions and bronchial spasms from frequent coughing. From the urinary tract, urinary incontinence. Cholinesterase inhibitors should not be given with other drugs that can prolong the QT interval on the ECG because this can cause a fatal dysrhythmia known as torsatus de pointes, a form of ventricular tachycardia. Dextromethorphan, found in over-the-counter cough medications, quinidine and fluconazole are 3 such drugs. Consult a drug reference or pharmacist to determine whether these drugs interact with other drugs the patient is taking. Anticholinergic drugs decrease the effectiveness of cholinesterase inhibitors, and taking the drug with other cholinesterase inhibitors, such as edrophorium, known as tensilin, increases the risk of adverse effects. Monitor for improvement using an Alzheimer's disease assessment scale. Monitor for any changes in vital signs and for adverse reactions. The expected outcome is the improvement of cognitive function, memory, attention, reasoning, language, the ability to perform simple tasks in patients with Alzheimer's disease. This medication is not a cure. However, it should help to slow down the progression of the Alzheimer's disease. A classification is N-methyl D-aspartate blockers, known as NMDA blockers. The action: slow the progression of Alzheimer's disease by blocking the entrance of calcium into neurons, which reduces or slows neural damage. An example of a drug is Namenda, known as memantine. The drug therapy attempts to increase acetylcholine levels because this excitatory neurotransmitter is reduced in the brains of patients with Alzheimer's disease. Acetylcholinesterase is an enzyme that specifically breaks down acetylcholine. A cholinesterase inhibitor is a drug that binds to acetylcholinesterase and slows its action, which allows any acetylcholine produced to remain functional longer. This action appears to delay memory loss and improve the patient's ability to perform his or her activities of daily living. Unfortunately, the drug is useful only temporarily. As the disease progresses, fewer intact neurons are available to make acetylcholine. When this occurs, the drug is no longer effective. 3 cholinesterase inhibitors are used to treat Alzheimer's disease: donepezil, known as Aricept, rivastigmine, known as Exelon, and galantamine, known as Razadine. The extended release capsules can be opened and the contents sprinkled on applesauce before swallowing. Do not divide the contents of the capsule because this will result in an unequal dosing. If the oral solution of the drug is used, do not mix it with other liquids. Use a syringe or a dropper to measure and give directly into the mouth. Monitor the patient's neurological function, serum creatinine levels, blood urea nitrogen, known as BUN, and liver function studies, and notify the healthcare provider of any changes from the baseline. Weigh the patient weekly because the drug can cause weight loss. The patient and family teaching: take or give memantine at the same time every day. The extended release capsules can be opened and all the contents can be sprinkled on applesauce if swallowing is difficult for the patient. If using liquid form of the drug, do not mix it with other liquids to avoid any type of interactions. Report problems with vision, rash, shortness of breath, agitation or restlessness, confusion, dizziness, incontinence, weight loss to the healthcare provider. Avoid driving or engaging in hazardous activities until the patient knows how the drug will affect them. Report if there's symptoms of urinary tract infection, acute changes in the mental status, frequency in urination, pain or discomfort during urination, concentrated and bad-smelling urine to the healthcare provider. Memanotine is eliminated primarily by the kidney and should be used with caution in patients that have kidney disease, people at risk for renal impairment due to age, and people taking other drugs that also have a risk of renal impairment. Baseline measurements of creatinine, BUN, and liver enzymes should be obtained. Urinary tract infections can increase the levels of memanotine by increasing the pH. If the patient has symptoms of a urinary tract infection, obtain a urinalysis, consult the healthcare provider before starting the drug therapy, monitor respiratory rate and vital signs, especially the blood pressure in patients with heart disease. Report symptoms of ataxia, dizziness, and other adverse reactions to the healthcare provider. The expected side effects of memanotine are headaches, dizziness, and constipation. The adverse side effects include hallucinations, worsening confusion, depression, somnolence, shortness of breath, incontinence, and weight loss. The drug can also cause hypertension in certain individuals. The drug interactions that increase the urine pH, make it alkaline, or are excreted by the kidneys can interfere with the renal excretion of memanotine and increase the expected and adverse side effects. The carbonic anhydrase inhibitors such as acetazolamide, which are used for treating glaucoma and high-altitude sickness, quinidine, and dextromethorphan are examples of such drugs. The evaluation or expected outcomes: the improvement in cognitive function, memory, attention, reasoning, language, and ability to perform simple tasks in patients that have Alzheimer's disease. Monitor for improvement using the Alzheimer's Disease Assessment Scale. Monitor for any changes in the vital signs and for adverse reactions.